Once we see someone in the office who's been referred because there's some concern about the possibility of a head and neck tumor, a very thorough and detailed history is obtained to try and focus in on where the primary site might be. And there's a thorough evaluation of the oral cavity, which is performed very simply. Then there's additional examination focusing both on the nasal cavity and the nasopharynx, as well as the back of the throat called the oropharynx and the larynx, which is the voice box, using specialized fiber optic or other types of high-resolution scopes that we can easily visualize the areas that might be potentially involved and get an idea if there's a tumor developing there. We do a complete and a comprehensive head and neck examination. There could potentially be more than one tumor that's developed, and only one of the tumors might be symptomatic. And it's not uncommon to get what we call a field effect, where the squamous mucosa, which is the area that develops the great majority of these tumors, can have any carcinogenic type of effects. And we want to make sure that we can get a thorough evaluation, as well as make sure that there's not potentially a second tumor in the area. In addition, we would also examine the neck to see if there are any lymph nodes involved at the same time, because obviously that's an important issue if there's any spread of tumor beyond the primary site. Once a tumor is identified, and once it's identified as being a cancer, then there are several tests that are done to what we call stage the tumor, to basically define, number one, the extent of the primary tumor, number two, is there any evidence of metastatic disease or spread of tumor to the lymph nodes of the neck, and the third staging we have to be careful of is there any metastatic disease beyond the head and neck, perhaps the lungs, the liver, the bone. These all increase the staging if there is increasing involvement of those particular areas. Typically there are 4 stages, stage 1 hopefully being an early carcinoma, an early cancer, and stage 4 is a more advanced disease. The proper diagnosis and staging is very important as a starting point to determine how best to go forward and hopefully effect a cure.